welcome to this session. And it's going to be a short session. It's not going to be too long. And it's the first session of this bootcamp presented by XYZ. My name is Felix Njoroge. I am an editor and also projects lead at the East African Journal of Neurological Sciences. First, we'll begin with a talk on principles of critical appraisal from Dr. Philip Mwachaka. Dr. Philip Mwachaka is the editor-in-chief of the East African Journal of Neurological Sciences. He's also a lecturer at the University of Nairobi. He's also a clinical researcher. He holds a bachelor's degree in human anatomy, MBCHB, a Master of Science in Human Anatomy, an MMed in Neurosurgery, a PhD, and also his postdoctorate.
Generally, we're going to discuss why we need to do critical appraisal of a paper. We'll also discuss how to go about critical appraisal of a paper and also some of the tools that can help us with a critical appraisal. So what is critical appraisal of a research paper? This is the process of carefully and systematically examining research. So there are some two keywords that we always need to remember: carefully and systematically examining research to judge its trustworthiness, and its value and relevance in a particular context. So we want to see whether the publication is trustworthy. We can trust whatever the authors are talking about, and then is it valuable research? Is it useful in our setting? And then the relevance in a particular context. For example, if you're in low and middle income country, is that research relevant or the findings relevant to your practice? So why is critical appraisal extremely important? Because research guides policy, and through research we have guidelines, for example, for management of clinical conditions, and also research helps us as clinicians to make decisions that help the patient. Recently, there's been a lot of proliferation of research, and this research has variable, basically variable research. We may be talking about research about hypertension, but we have very many studies with different results. So we need to have a way of looking at these publications to decide whether we can trust whatever the authors are talking about. Because with these variable research outputs, there's risk to patients and resources, especially if we use the wrong research. And then there's the issue of predatory publishing, that we have some journals that are usually published for the sake of publishing, maybe to get money from the authors, and then they end up just publishing research articles that may not be very trustworthy. And authors may also employ some questionable research practices. Yeah, so things like selective reporting. You report things that were positive from your study, and you don't report negative findings. So it is extremely important to conduct a thorough critical appraisal of a paper to be able to detect some of these things. And recently, we've had issues with AI being used to write papers. AI can be used to assist you improve on your paper, but should not be used to write the paper. So you can have conversations with AI, and it can even generate methodology for you and all those things. So we need to be aware of that, and it is therefore important to know the skills of critical appraisal. So critical appraisal is not negative dismissal of any research. I know when we were young and starting our research career, anytime we heard of critical appraisal, we thought that we are going to dismiss the paper in totality. And critical appraisal is basically to learn more about the paper and look at its trustworthiness, value, and relevance. And it's not based on statistical analysis. And it can be undertaken by anyone interested in the field. So that's one thing you need to be aware, that any of us should be able to have these critical appraisal skills to be able to look at any paper that is in our field and to be able to make a good judgment. So there are three principles of critical appraisal. The first one is validity, reliability, and relevance. We'll be discussing each of those in detail. So always remember validity, reliability, and relevance. Okay, so what is validity? This is the trustworthiness or the truthfulness from the research paper. And basically, it also includes lack of bias. So the biggest question you try to answer by looking at the validity of the study is, does the study measure what it intends to measure without bias? We'll be looking at the definitions of bias later, but that's the biggest question you need to answer when you're looking at the paper. And these are the things that can help you assess validity of the research paper, like the research objectives. So is there a research question? And are there objectives that are clearly stated? Most of the time you get this when you're looking at the abstract, as well as the introduction or the background section of the article. And then you also need to look at the methodology and see whether the study design was appropriate to answer the research question, because you can have a research question that implement the wrong study design. You'll still get results, but those results may not be able to appropriately answer the research question. And then issues of bias, whether the authors try to minimize bias from when they were executing the study, all the way from study design to even reporting of the results. And authors need also to declare conflicts of interest. They also need to talk about how they did their participant selection and data collection. The next thing that we need to be aware of when we're doing critical appraisal is reliability. And this is basically consistency and rigor. Okay, so were the method rigorous enough? Were they consistently being applied? If you're looking at maybe a study involving patients or any participants, were the methods consistently being applied? Because this is very important when you want to do a similar study in the same population. We should be able to get the same results or near same results. So some of the things that are important when you're looking at the consistency and rigor of the study, basically the first thing is rigor. So were the methods rigorous enough? Did we use appropriate methods for data collection and analysis? Then we look at completeness. Is the information provided complete enough for someone else to replicate the study? And then the last thing is precision. How precise are our results? And we'll look at some of those measures of precision. But the key thing that you need to be aware of is the sample size. So it needs to be very clear the sample size that was used, how that sample size was arrived at, and any assumptions that were made during calculation of the sample size. And then also the statistical power needs to be clearly stated. The third thing that we need to be aware of when doing critical appraisal is relevance. of the study. So we have a good paper. Is it applicable in our context? Is the study useful and applicable to your specific situation? So these are some of this is extremely important because if you are maybe a clinician talking to a patient and you start quoting some study and maybe they're using some drug, maybe a certain drug was tested, for example, randomized clinical trial, and showed that it was very effective and beneficial for a condition that the patient before you has, but then that drug is not available in your setup. And then it means that you can't really apply those study findings to your practice at that moment. So it needs to be clear when you're discussing things, for example, with consumers or the patients, that whatever you're quoting is something that is really applicable. So the three areas that you need to look at is the context, and we've already discussed that, whether the findings are applicable to your patient population or research. And then contribution, does the study add anything new to the existing body of evidence? So you may do a study that is, and we see this a lot when we submit maybe manuscripts for review to journals. Then you get reviewers saying that, well, this is a good study. We had very good study methods. They are reliable. Someone can replicate those methods, but there's nothing new you are adding to the existing body of evidence. So these are the things now you need to look at when you're doing critical appraisal. And then the last thing is clinical significance. And we need to be aware of the difference between clinical significance and statistical significance. I think I will be talking about that in the later slides. But this is extremely important because you may be studying maybe a disease, or you're doing a trial using some drugs to try and treat a certain condition that does not have cure, for example, maybe a certain type of cancer. You do a randomized controlled trial, you have results that show some benefit, but maybe those results were not statistically significant. Then the next question is it clinically significant? Yeah, even if it was not statistically significant, is there any benefit using this drug for treatment? So I think that's something we need to be aware of when we are doing critical appraisal. So I'll just go through the process of doing critical appraisal. This is the outline. You should start at looking at the research question, okay? Things that we've discussed about reliability, validity, and relevance. So you're trying to look at is there a research question? Are there clear objectives? Then how was the study designed? So this basically you get it on the methods. And then the next thing is how was the study conducted? Okay. So you're trying to see whether, you can have a very good design, but you're not able to implement the design through the conduct. So it's so clear that this needs to be reported and looked at. And then you have done your study and have results. How was analysis done? Extremely important. And interpretation. So it's just the outline of how to conduct the critical appraisal of a research paper. So looking at the relevance and question, there are some tools that are important. We'll be talking about that PICO and FECOT tool. And then looking at methods and bias, okay? Look at analysis and reporting, then results and interpretation, and the applicability and ethics. This is extremely important, the ethical considerations of the research. So on the first point, the research question. This is extremely important. And if you want to analyze the research question, then the following must be clear from the research paper or article. Population studied. Okay, so this needs to be clearly described. For example, you state that I was looking at adults with stroke. That is population. And by adults, you have to be very clear. You state the age so that we know that if we repeat this study on that specified population, then we are likely to get similar results. And then the other thing is inclusion and exclusion criteria. So I know you know the details of this. And so those also have to be clearly stated. And then the setting, where did we do the study? Was it in a hospital-based, was it a hospital-based study? Was it community-based study? Where is this community? So you need to describe it clearly. If it's a hospital, for example, Kenyatta National Hospital, you have to describe where this hospital is, what level of the hospital is, and maybe the kind of the patient population, where is a referral hospital. So all these have to be clear so that when we're looking at the results, we are aware that this was, for example, level 6 hospital. So maybe by the time patients reached the hospital, maybe it took time compared to, for example, study done on a level 1 facility. Yeah, then the other thing that has to be described clearly is the intervention or exposure. So we gave patients with hypertension, adult patients, newly diagnosed hypertensive patients, drug X. So this drug has to be clearly described because that is the intervention. So the dose has to be stated. And then the timing, for example, how frequently we gave the drug, this needs to be clearly stated. And then the comparator. So basically, did we have was there any controls? Were there any controls? Or was there any, and by controls we basically mean you can sometimes compare maybe a new drug to standard of care. I'm just using a drug as an example, but the intervention can be many things. So intervention could be, for example, a device. Maybe you're trying to see whether a certain device is useful to maybe for treatment of a certain condition, or a certain intervention could be implementation science interventions. So we're just trying to test this intervention, and then you look at comparator. And the comparator could be maybe the usual standard of care, if maybe there's a drug used to treat that condition. So we need to see whether that was clearly stated. Was there like a placebo or maybe historical comparator? So historical comparator basically means you are trying to bring in an intervention, but you had historically or previously collected some data, maybe, and observed that in our setup, when we treat these patients with this standard of care, we are having these outcomes. So you then try to bring an intervention. So your next phase of study is just an intervention, but then your comparator is the data that you had previously collected when you're not doing this interventional study. The other thing that needs to be clear is the outcomes. And there are outcomes that are very, very important, especially when you're looking at interventional studies, like mortality, the function of the patient, if it's like a seizure medication, a seizure freedom. And then was there use of validated scales to assess the outcome? So if you are looking at pain scores, they are usually validated scales for that, cognitive functions, etc. So these ones have to be clearly stated. And then time frame for follow-up. if you're looking at outcome, it needs to be stated clearly. Maybe we followed up our patients for 12 months or 6 months. So that time frame should be clearly stated. So whenever you see vague objectives, then that should raise red flags. Surrogate only outcomes, so outcomes that are just favoring the study, okay, that we don't have these are standard outcomes, mortality, function, those ones should be there. Yeah, but not maybe drug level. Someone just measures outcomes that are going to favor the results of the study. And then selective outcome reporting. So when you see that, then you should note that that study may not have had it was not very rigorous and may not be very valid. And then the study design, I'm sure you are all aware of the study designs. So look at the study design that was used in the study, and look at it whether it was appropriate to answer the research question. So there are several study designs. I think I will leave you to look at this later on. Internal validity. So this basically includes bias and confounding. So you can have some bias, and bias can come in several ways. I'm sure most of you are aware of bias. You could have selection bias. So for example, when you are selecting your patients, you select patient profile that will have better outcomes in the intervention compared to maybe the standard of care. So you see now that is already introducing bias. So for example, you're trying to study drug X, and then you have this, maybe this is a patient with condition X, condition Y, and this condition has maybe several, it has grading system. So patients with maybe less severe grades, you give them the intervention. Obviously, they're going to have better results, and that on itself will render the study invalid. So also measurement bias. You're measuring some parameters, and then the assessors are not blinded. Okay, or you could be the one doing the measurements. So intentionally, for those that are on the intervention, you give them favorable values. Okay, so that brings in measurement bias. And if you're using unvalidated scales, okay, so scales that have not been used in other previous studies and have not been validated. The other issue is attrition bias. So basically, differential loss to follow-up. If it is so severe that you have some patients maybe lost to follow-up in a certain arm of the study, that can really introduce a lot of bias. Then basically, confounding. If you were able to mitigate for confounding factors like randomization, matching of the cases, or statistical adjustment, things like multivariable adjustment, and using instrumental variables. So for this, there are some tools that are recommended. I'll be talking about them later. But there are some tools when you're doing critical appraisal of a paper, you can look at them based on the type of the study design. But like this, ROB2 is you're looking at bias in randomized controlled trials. And then Robin is usually for non-randomized studies. So basically, we look at this, but there are tools that can really help you in doing critical appraisal. Then the other thing that we talked about was the sample size. So it is key to look at how the sample size was derived. and whether there was any power and precision. Okay, so assumptions must be stated clearly. For example, the effect size for the study, the power variance, and such things. Precision. This is extremely important when you are reporting the results. Most people or most authors will tend to report p-values only, but it is extremely important to show the confidence intervals because we can quickly assess from the confident intervals whether that study was significant or not. And then also the reporting of the outcomes. So anytime you see a study that didn't have power calculation, especially either an observational study or a trial that didn't have power calculation, then that should raise alarm. Or if you look at the sample size and then you find that they were small, the subgroups had really low numbers, then the authors are reporting that there's really significant, maybe the results were significant in a certain subpopulation, and yet that population had, for example, less than 5 individuals, then that should raise an alarm. The other thing that needs to be very clear is in the results. So the results have to be, there should be clarity and consistency. The first thing when you're reporting results, it's always good to have a flow diagram. And we'll look at those consult and stroke recommendations. And this flow diagram should have numbers at each stage. So the first thing that should be clear is the number of eligible participants, for example, for your study. Maybe you are doing a clinic-based study. You're studying people with a certain condition. And based on your inclusion criteria, you were conducting a study, let's say for 1 month. And based on your inclusion criteria, maybe 100 patients met the inclusion criteria. So that should be clearly stated. And then state that the next thing is now after excluding. Okay, so because your exclusion criteria should be for the patients or the individuals that would have met the inclusion criteria, but based on 1 or 3 factors cannot be included in the study. Maybe they didn't consent for the study, or they had other things that led them to being excluded. So that has to be clearly stated in that flow diagram. And then now, of all those now that were involved in this, that were now included in the study, then maybe you randomize them into maybe the study arms. So that needs to also be to be clear. So of 100 patients that met the inclusion criteria, we excluded 8 patients and had 92. So these 92, we randomized them into 2 equal groups. So that has to be also stated. And then now, after randomizing them, maybe some were lost to follow-up. So that has to be clearly stated when we are reviewing the paper, the research paper. Okay. So you also need to look at things like the primary outcome. It has to be reported first, and then secondary and other outcomes in that order. So in your method, the method should be clear, should state clearly the primary outcome. So if maybe the primary outcome was overall survival, or maybe reduction in pain score, or reduction in blood pressure. So that has to be the first thing that should be reported in the results after the flow diagram and the baseline table. Baseline table basically contains demographic factors. Yeah, so that primary outcome should be reported first, then the other outcomes. And then other things that need to be clearly stated are adverse events. And this is more so for studies that are involving some intervention. So we need to always report the adverse events. We should not hide them. I know people would like to hide them. You can have an intervention that has very good results, but maybe had a few adverse events. So it's always good to report that so that whoever is trying to do a similar study is clearly aware of those adverse events and can take measures to mitigate those events. So you need to report the risks, so absolute and relative risks, and severity of these events. And then the other thing is the figures and tables need to be very clear, and there should be consistency from the results reported in text and what we have in the figures and tables. So this can really help you when you're doing critical appraisal. For example, when you see mismatch between text and tables and figures, so that should raise alarm. And then if you're finding some denominators are changing, and the authors are not clearly stating why there's change in those denominators, then you need to raise an alarm. And if you are a reviewer, or for example, you are doing the critical appraisal, those are the things that need to come out. And then the other thing that would be important is interpretation of the results. So statistical and clinical significance. So we talked about this. So it needs to be clearly stated the statistical significant threshold. Most studies will put P at 0.05. So that one has to be clearly stated. And then also you need to consider minimally or minimal clinical important difference. And this is what I was talking about when we are looking at studies that don't have statistical significance, but may have clinical significance. And it's extremely important for maybe a disease that is really causing a lot of mortality. You remember, like when COVID came in, people were testing very many interventions, and whatever intervention that was shown to have some clinical benefit was allowed to proceed, and people are now being those drugs were available for use. Yeah, so it's extremely important to always think of that. And then in terms of interpretation, consistency with prior evidence. So this basically involves looking at maybe doing some literature search and how the authors are interpreting their findings with regards to previous literature. For example, previous interventions that have been used for the same type of condition. So this needs to be clear. And one of the final things would be ethics and transparency. Do we have institutional review board approval for the study? And has it been stated in the research article? So that has to be clearly stated. You have to state, for example, if you're doing a study in KNH, you have to state that you had submitted your study to the University of Nairobi, Kenyatta National Hospital Ethics and Review Board, and they give you an approval, and that approval usually has a number. So that number has to be clearly stated. And then you also need to state that there's some form of consenting. So did you have informed consent? And was there assent? For example, in children who are older, you need you need some form of assent, even if maybe their next of kin or their parents gave consent. And then was there any confidentiality? Okay. And also data protection. How did we secure the data? Did we have some forms of trying to lock this data, preventing it from access by other individuals who are not part of the study? And that has to be clearly stated. And then if it was a trial, then you need to report that you had registered that trial. And we have those sites where you can register your trial. And also the protocol has to be clear. This is very, very important for transparency. So we had this study and we are trying to investigate this device or this drug on this condition. This was our protocol. This was our population. This was the inclusion criteria, exclusion criteria. So basically the details of the methods. So that has to be registered before you do your study. And there should be evidence that that trial was registered. And then also data sharing statement has to be there in the article because it's extremely important. Sometimes we may see some study that has very good results, and maybe it's a condition that has had very many issues, like maybe mortalities, poor outcomes. So anytime we see a study that has very good outcomes, then we may want to interrogate the results. So it should be clear from the authors that they are willing to share their results. Basically, maybe the identified database of the study participants. And nowadays, there are also sites where you can deposit your database, the identified database, so that other people can access it and also interrogate it. And we should also have the other thing that should be stated clearly is the conflicts of interest. Okay. Funding sources and role of funders. For conflicts of interest, I could be the manufacturer of a device and I want to use this device for treatment of a certain condition. For example, in our case, neurosurgery, trying to treat hydrocephalus. So I manufacture a device that can be used to treat this condition. Then I am the PI of a study. Okay, so that is already introducing some conflicts of interest. So that needs to be clearly stated that this device was developed by X, Y, and Z, and X, Y, and Z was not directly involved in the study. Or if they are directly involved in the study, then their role needs to be clearly stated. The other thing is about funding. So you may get funding as a researcher to do some study. And for example, to get funding from a manufacturer of a device or a drug to do a study. And this funder may want to see the results in a certain direction. So it is extremely important that you state your sources of funding so that it's clear to whoever is reading the paper that there was no conflict of interest in terms of funding. So sources and the role of funders. Okay. So as we end the talk, there are some guidelines that you can use when you are conducting a critical appraisal, and it will be important for us to look at them as we now start this journal club. So adopt checklists to verify completeness and reproducibility. We have checklists for various type of study designs. I would really encourage you to look at them. For example, for trials, we have the consort checklist, and this is basically the consolidated standards of reporting trials. We have the STROB for observational studies. I have put hyperlinks on this presentation, so later on you can really go back and look at these checklists. They are very important, especially for authors when you're submitting your manuscript. If you go through the checklist, then reviewers are likely to have an easier time, and you're likely to have a very good review output. So as EHNS, we have developed templates for appraisal of papers, and Felix will be sharing them. They are in our drive somewhere, and they are shareable. We can use them for assessing papers, especially if you are thinking of submitting a manuscript. You can also use these templates for critical appraisal. For example, if you're a reviewer or you're just doing appraisal for your own benefit. And then we have critical appraisal tools. Okay, these are now for papers or research that has already been submitted. If you look at this site, the CASP site, it has checklists for various study designs. So this is the Critical Appraisal Skills Program. There's a hyperlink there you can click and see. And then we have now for systematic reviews, there's that AMSTAR tool, and then the quality assessment of diagnostic accuracy studies. And then the risk of bias is extremely important for randomized control trials and then randomized studies, because you're looking at bias. So you're trying to assess bias, and when you look at this, you'll find it's really detailed and can really help you with a critical appraisal. So in summary, when you're doing critical appraisal, you need to follow, there's a systematic way of looking at it. Try to match the research question with the study design, the methods, then look at the analysis and look at the interpretation and the influence of the result. And then look at how the reporting of the results has been done. Look at the estimates and the intervals, the confidence intervals, rather than p-values. So people can just mention that this study was statistically significant, p-value 0.001, but they've not provided you the estimates. For example, if you're looking at the mean or the median, so you need to see the estimate and for the measure and the interval. So most of the time is confidence interval. Then look for transparency, especially registration, for example, of the trials, protocols, if they've been registered, and whether there's any statement for data sharing. And then as you are looking at the research, you also need to look at whether the outcomes reported are patient important. And we saw outcomes like mortality, function are extremely important, rather than just some vague outcomes that may not really help in making clinical decisions. And finally, we've gone through structured checklists. We'll be sharing the presentation. It will be important as we now start this critical appraisal, this journal club, we go through the checklists. So thank you so much. Are there questions?
Thank you so much, Dr. Mwachaka. It was an excellent presentation. So kindly let's just appreciate Dr. Mwachaka for that very elaborate presentation on the skill of critical appraisal. Then there is a question to Dr. Mwachaka from Regent, and he asks, in the case of attrition, are the results collected from these participants reported? If yes, is there a defined adjustment that has to be done when doing the statistical analysis?
Yes, so thank you so much for that question. Yes, so there are statistical methods that you can use to adjust for maybe attrition and missing values. Some of those methods, maybe we'll be discussing them later on, but things like multiple imputation and reverse probabilities. Yes, so the answer is yes. There are methods that you can be able to use. These are mostly statistical methods that can be used to help you in cases of missing data.
Thank you, Dr. Mwachaka. So there are three other questions, I think, from anonymous attendee. I think those are probably three different people to the same person. One question is, could peer reviewers use critical appraisals to reject or accept research articles?
Yes, actually, we are encouraging peer reviewers to be aware of these critical appraisal tools, because when you're doing peer review, you're basically doing appraisal of the manuscript. And to improve on the manuscript, then it may be good to do a very thorough critical appraisal of that paper that you've been assigned to review. And we will encourage that all of us can be reviewers. So let's familiarize ourselves with them, with the tools that can be used for critical appraisal. Yeah, so the answer is yes. Reviewers, what they do is critical appraisal of the manuscript.
Then the next question, in scientific publishing, what manuscript weaknesses are considered non-negotiable and lead to rejection versus those that can be successfully addressed through revision and rewriting?
Yes, I think it's case by case. For example, when you look at a study and the methods are flawed, so you see that whatever methods were used were not really correct, that can lead to rejection. Or if we discover there's some scientific misconduct, then the reviewers will just reject that paper, or they may ask you to they may give you some questions to answer or some suggestions to really get more details. They may also ask you to actually send them the results, the raw data, so that they can analyze further and see whether the results are correct. But some minor errors can always be accepted. So when you have such things, then the reviewers will write their report and suggest whether the article needs to be rejected or reviewed after corrections. Yeah, so it's usually based on its case by case.
Thank you. Then the next question, I think I can also just help you answer this question. Is a research bootcamp restricted to neurological sciences only? So no, it's not. And that's why it's a club, and we're collaborating with 4 other regional journals. We're collaborating with the Jogeka, the Journal of Obstetrics and Gynecology of East and Central Africa, JOCAP, the Journal of Kenyan Association of Physicians. If I get it wrong, please forgive me. And then we also have Annals of African Surgery and the Anatomy Journal of Africa, which will cater for different types of research work and different topics, not just neurological sciences, and not only just clinical work. That's why we also have the Anatomy Journal of Africa for other preclinical and anatomy, and also it's a comprehensive and all-inclusive bootcamp where we look at different published work. So the next question for Dr. Mwachaka, in the case that there is a conflict of interest that is stated, should you disregard the study?
Not really. So that is part of transparency. So if the authors have declared conflict of interest, then we like it that way. And then we just look at the merits and demerits of the entire paper. So it's usually good actually to declare the conflicts of interest.
Thank you. And then another question from Melanie. How do you interpret statistical significance versus clinical significance in a critical appraisal? For example, if the study is clinically important, but the p-value is not significant.
Yes, so and that's why I gave an example of maybe a condition or basically you're doing a study to look at maybe a new intervention for treating a condition that does not have a cure. Okay, for example, HIV or maybe cancer, certain form of cancer that doesn't have cure, and maybe there's a drug that has been developed, and you're trying to see whether this drug can lead to cure of some patients or can lead to maybe increase the overall survival. So when we look at the study results, the authors may report that when we compare to standard of care or when we compare to just the controls, it was not statistically significant, but when we did subgroup analysis, we had this group of patients that had shown some improvement. Maybe these patients had certain maybe parameters, maybe their age, or maybe some biomarkers you studied in blood. We found that those that had those parameters had better outcomes. So then that means there was some, although the study didn't have statistical significance, there was some clinical benefit in a certain subset of the participant. So that's what we call clinical significance. And now this can lead to now maybe another study just looking at that subset of the study population.
Maybe you can have the last question, which is on how determination of rigor and the statistical power.
Yes. So when we review papers as editors, one of the things that are extremely important to us is the methods. And that's where the rigor for the study is actually should be clearly stated. All those things that I explained from definition of the population, looking at inclusion and exclusion criteria, definition of outcomes and how those outcomes are being measured, whether you're using validated instruments to measure your outcomes, and also looking at the detail of how the study was conducted. Okay, so that's one of the some of the ways we look at the rigor, and then the other thing is now the sample size. So how that sample size is calculated. There are usually formulas available for calculation of sample size. You can look at them on the internet based on your study design. So those are usually specific, and they need to be. You need to quote the formula that was used for generating your size. And also the other assumptions that were considered, for example, the power and effect size. And in all these things, we can have maybe sessions later to discuss them because they are really detailed. But the rigor is usually in the methods. So starting from your objectives and how you try to achieve those objectives of how you try to answer the research question. Thank you.
Thank you so much, Dr. Mwachaka, and thank you all for your questions. I'd also like to acknowledge Daktari Online, who are our partners at XYZ EMED and also EAJNS for also providing the conferencing platform, and they are one of the leading platforms for learning for healthcare professionals who would like to learn and earn CPD points, connect, build communities, and a lot more. I think if you check the chat box, you'll see there's a link to the Dr. Online platform, which is drionline.africa. And you can view, then go see what they have. And they also have CMEs, among other activities. So I'll just quickly skim over what the Journal Club is about, and then I hope my screen is visible. So as you mentioned, it's a collaborative effort which has been designed to nurture critical appraisal skills, and so among the readers and also among the scientific community, and to also promote engagement with local journals, and because we also really want for on our side to also have more readership of the work that is published. A lot of effort goes into editorial work, and also even for researchers, you'd also want people to. The reason you're publishing it is because you want people to read the work that you've worked so hard to do and share, and often the work that is relevant and contextualized to our area, to our region rather, is published in our local journals. And so really want a lot more people to interact with the issues we publish. And also, the more you read papers, the more you'd be inspired to also um, maybe do your own research and also publish. And so that's the primary objective, to just promote, number one, the critical appraisal skills among not just students, but any early career researcher and anyone who's interested in scientific work. And again, we'd also want people to engage with our journals, and through that, we'll also create a good pipeline of capable peer reviewers for our regional journals. We mentioned these are some of the opportunities we'll be offering. So in either of the collaborating journals, and so that you join and also contribute to the research ecosystem as a peer reviewer, and that will also be coming with its advantages, and also for you as an individual, as you progress as in your career. So the collaborating journals, we have 5 journals. The East African Journal of Neurological Science, that's us, will be taking lead in terms of also developing the materials. I'll quickly skim over the different templates that we've developed that we'll be using for the sessions. We'll be having different papers from different journals for different sessions, and we have very simple tools. Some of the tools that had been shared earlier, some of them tend to be quite technical, and they may not be very um, beginner friendly. So we try to really simplify them and just break them down into specific critical questions that are easy to understand and that you can also process as you read the paper, and then revert to as you submit the report, and we'll go through the expectations for you as participants for the journal club. We also have a JOCAP, which is the Journal of Kenya Association of Physicians. So this is IMED, uh, internal medicine mostly, and any work related to physician research. And then you have JOGECA, which is OB and Annals of African Surgery, which is mostly surgical research, and Anatomy Journal of Africa, which is anatomy and maybe physiology, and various basic topics and some clinical anatomy, etc. And we'll have papers being picked from each of these journals in a rotational basis. So we have collaborating partners. We mentioned Dr. Online. We also have XYZZ, also coordinating and also helping with communications. But we also have other student-led organizations, and these are key collaborators because they have been organizations which have been putting effort to try and grow the research culture within various institutions. And so they'll be the presenters for each of the sessions. They will be the ones presenting an overview of what the paper is, and also perhaps having an opportunity to talk about the work they do, such as SCORI, which is a Standing Committee on Research Exchange, and SAKE, which is a Medical Students Association of Kenya, and the University of Nairobi Research Club, Kenyatta University Medical and Ethics Research Ethics Club, and the Student Surgical Forum. So each of these organizations will also be presenting on a rotational basis. So the program structure, it's going to be 6 months, fully online, bi-weekly. Bi-weekly meaning once every 2 weeks, so twice a month, for about 1 hour, not too long. And each session will be about 1 hour, as I mentioned, but we'll start with number one, an overview of the selected paper. So the collaborating partners will be the ones presenting for this first 15 to 20 minutes. So just not giving any critiques, just presenting the content of the paper as it is. So it's going through, this is the background of the paper, this is the methods, these are the results, this is the discussion, and this was the conclusion, and that's it. And then thereafter, for about 20 to 30 minutes, we shall have appraisal and feedback session from the audience, which is you as a participant. So the expectation is that number one, you'll have read the paper and also submitted prior to each session. That's why it's 2 weeks, so that you have enough time to actually read and submit reports, which will be evaluated and also scored. We shall have like a report card at the end of the boot camp after 6 months. And during this time, you'll have the opportunity to give feedback, your thoughts, your questions, and just on the papers that we'll be sharing. So we'll, even after this, we shall send emails of the selected paper. And and then after that appraisal and feedback session, so we expect that you'd hopefully be active. You're encouraged to unmute, use the chat box and all, and just give various discussions based on the paper that was selected. And then for the final part, we shall be having guest editors from the different journals. So depending on the paper that has been chosen from that specific journal, we shall be inviting one of the editorial board members to just come in and listen and also give their reflections on how the session was and maybe a few tips here and there. So in terms of what you benefit from this bootcamp, number one, it's what you gain. And the skill of critical appraisal is important, and it helps you even grow in terms of how you'd also be thinking and interacting with materials. But of course, as we mentioned, you'd also have the opportunity to be onboarded as a peer reviewer for different journals. And at the end, the certificates will give you certificates signed by the different editors from different journals. And this will also be CPD points, which is something we're working on. Yes. And also just periods of learning. Yes. And we hope you enjoy that. So we'll quickly just go through the timetable. I hope it has changed. Let me just reshare to make sure. Yeah, it's changed. So we'll quickly go through the timetable of the entire journal club. So as I mentioned, it's bi-weekly. So once every weeks, which is the first and third Thursday of each month, we'll start in November, which is next month. And we shall start the EJNS, JOCAP, JOGECA, Anatomy Journal of Africa, then Annals, then repeat. And we shall be going through different articles, original research, reviews, case reports, policy papers, just to have diversity of the different papers that you have interacted with, you'll have interacted with by the end of the session. And so this is a timetable, and so this is today, and we're done with that. So for the rest of the sessions, the expectation is that there'll be active participation from the participants. So they'll no longer just be just the instructional webinars. No, so for now, it's going to be you actively reading, giving your feedback on the papers, and then being evaluated on the same. So we'll be sharing via email the papers that we selected, and also via some of our other channels. So if you'd signed up and you did not get the initial email, there were a few emails that maybe someone put a typo like in the email, so maybe .vom instead of .com, or any issue that may have led to you not getting an email. So just send an email to the eagnseditor.gmail.com, and we'll allow you to just sign up again so that we correct that. So that's it for this introductory session. We hope it was helpful. We shall share the recordings and we shall continue communicating and engaging further in subsequent sessions.